Hey friends, I'm Dr. Molly. I'm a veterinarian near Nashville, and this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to know more about both of those things. So welcome to the Dr. Molly Says podcast. Friends, we are opening my practice in 2 weeks. I have been MIA for the last 2 weeks because, life is very busy right now. But today we are going to do an episode that is, I wanted to call this podcast Vet School for Pet Owners originally, and I didn't want to kind of like put myself in a box, which is why I changed it. But that is what we're going to do today. This is an episode of Vet School for Pet Owners because I very much believe that educated pet parents are the best pet parents. And so I want to help educate you. So I am going to talk about diseases. We're going to cover a lot of diseases because what I really wanted to do was just give you a very sort of short and to the point rundown of all the diseases that we typically are going to recommend that we vaccinate against in your dogs and your cats, because I think it's important for you to know what they are. We don't talk about these diseases a lot, and a lot of the reason for that is because we do a really good job, or have done a really good job, of vaccinating for them. And so a lot of these diseases we don't see a lot, or we haven't seen a lot. We are seeing more of some of these diseases because we are vaccinating pets less. And that's another reason why I think it's really important that we talk about it. So that's what I'm going to do. It's a lot to cover, and I don't want your attention span is going to be gone in like 25 minutes from right now if we don't make this short and to the point. So that's what I'm going to do. So I'm going to tell you about all the diseases vaccines are protecting against and what they look like and why we probably want to protect our pets from them. So I'm going to jump right into it. So we're going to start with dogs, because dogs have a little bit more to cover. And if you've ever had your dog vaccinated on any kind of regular basis, then your veterinarian has probably talked to you about distemper parvo. And that's what we commonly call a combination vaccine that we consider a core vaccine in dogs. And it's not just distemper parvo. So I want to tell you what's in it and why we recommend it. So the DA2PP is what we often call this vaccine, and it has 4 pathogens that it covers or protects our dogs from. So distemper, adenovirus, Parainfluenza, and Parvo are the 4. And you've probably heard of Parvo. Parvovirus, most people know about if they know anything about dogs. And many of you also have heard of distemper because that's what we call it. But a lot of people don't know about adenovirus and Parainfluenza. So let's talk about what you probably have heard of. So we'll start with distemper. So distemper is a virus. It is very, very contagious. It is a morbillivirus. I do have notes. I'm going to try to stay on task. And it is actually a virus that's related to the virus that causes measles. So interesting. It's spread through respiratory. We like to use the term respiratory droplets. So respiratory secretions between animals, so infected animals. And dogs can encounter distemper virus via wildlife. So raccoons, foxes, coyotes, other carnivores can carry and pass on distemper, which is another really important reason that we vaccinate for it, because our animals can catch it from wildlife. They could also pass it on to wildlife. And distemper is terrible. It is a horrible disease. It is just terrible. It's terrible for the patient. It's terrible for the pet parent, and it's terrible for the vet staff that has to treat the patient for it. Because it is very contagious, much like Parvo. If we ever have patients with distemper, we have to be really careful about having them in our hospitals because we don't want anybody else to get it. So distemper is pretty savage. It affects multiple body systems. So once a dog is infected with distemper early on, they just get sick. So they can have fever, eye discharge, nasal discharge, coughing. They look respiratory often at first. They can have GI symptoms, so they can have some vomiting and diarrhea, and they may not want to eat. Often that's just because they don't feel good and they have a fever. Distemper is ugly as that version. So respiratory, some GI, they are sick. They can recover from that part of distemper, even though they definitely are very sick, and often it's puppies that have distemper, and so that part of it can be fatal. But what's particularly terrible about distemper is that it has a neurologic form. So it is possible for distemper as a virus to invade the neurologic system, the nervous system, and it can cause seizures, convulsions, muscle twitching, and abnormal movements. And eventually it causes weakness and paralysis. And most of these patients that have the neurologic form of distemper do pass away. Because we really can't treat them. We just have to support them and hope that they can fight it off. And it's very terrible and it is miserable for them. And so it's not just a respiratory infection, even though that's how it usually starts. The other scary thing about distemper is that dogs can be infected with it. They have the respiratory, like typical initial symptoms of it, and then they get better. And then the neurologic part of it can affect them weeks to even months later. So that's kind of a scary thing about distemper, is it can like haunt them later and make them sick with the neurologic part later. So this is why we do recommend that you vaccinate your dog for distemper as recommended. Often clinics are following AHA guidelines for distemper vaccination. And contrary to some belief on the internet, we used to recommend distemper vaccination like every year in dogs. But as more studies on how long the vaccines provide protection across a large population of dogs, those recommendations have changed, and we do feel confident that dogs can have protection against distemper with vaccines every 3 years after their initial puppy and then 1 year booster. So that's great because it means we can protect them for longer with vaccines, and some dogs even have protection for longer than 3 years. The problem with saying that and saying we don't need to vaccinate every 3 years is that it's really hard to know which dogs do and don't have protection for longer than that. And we don't have a good way to predict when they're going to lose adequate protection. So titers are great. And this kind of applies to several things. So I'm not going to talk about this with every disease, but this is the first one. So a lot of people online talk about running titers instead of doing vaccines. And titers for distemper and parvo especially, I think are a great idea to run every year. But once we get to that 3-year mark, after the 3 years, yes, it's a great idea to then keep checking titers if we're not going to vaccinate for like distemper or for parvo. But the problem is once a titer level gets low enough that we would need to booster a vaccine, we don't know how long that has been that low. Does that make sense? And so if we're checking a titer once a year, there's 12 months in between the two titer checks where it could have dipped below the protective level. And so I do think, the 3-year vaccination recommendation for distemper parvo really makes a lot of sense. And so in general, I do think that's a good idea. The other great thing about the distemper vaccine is it's very efficacious. So there's studies on this, on how well do vaccines work, and the canine distemper vaccine has efficacy that approaches 99%, which means when vaccinated properly, these dogs are 99% likely to be protected from the distemper virus. So it's a really great vaccine. It makes distemper really uncommon, and we want it to stay that way. And the more people decide to not vaccinate, the more likely we are to see more distemper. And I promise, pinky promise, we don't want that. All right, that's distemper. So next is adenovirus. Adenovirus is interesting. We call this vaccine the combo DA2PP, and that's because it's adenovirus type 2. But what's interesting is we are vaccinating against adenovirus type 2, or we're using adenovirus type 2 for the vaccine, but we're also protecting them against adenovirus type 1, which is just kind of like an interesting, cool virology, immunology thing. So what is adenovirus? So it is an infectious hepatitis. It affects the liver, and it is spread through bodily fluid, particularly urine, saliva, and feces, which is very common. And it attacks the liver primarily, and so it can cause liver failure, liver damage. It can also damage blood vessels, the kidneys, and other tissues. So not only the liver, but primarily the liver. dogs with adenovirus are sick. They have a fever. They can be lethargic. They can vomit, not want to eat. They can have abdominal pain. And because it affects the liver, liver disease, liver failure can go along with bleeding problems, and liver dysfunction can eventually lead to death. It can lead to neurologic issues as well if the liver is not doing its job. One kind of classic sign of adenovirus in dogs is what some people call blue eye. So because of what the virus is doing, they can get corneal edema. So fluid within like the surface of their eye, and it can make it look hazy and kind of blue. So that's sort of like a telltale sign of adenovirus with dogs with those symptoms. So it can be fatal, absolutely dangerous disease, and dogs are also pretty sick with it. And again, they're contagious, so they can pass it on to others. So, something a lot of people don't realize is that adenovirus too is one of the pathogens associated with like the complex of kennel cough diseases. Interesting, fun little fact. So the vaccine is one that provides, again, very strong protection. We do want to vaccinate like puppies, especially appropriately. So they get a series of vaccines when they're puppies as their immune system is developing and basically weaning itself off of protection from mom. And the adenovirus vaccine, it works really, really well, and it works for a long time, we think. So again, another reason why the recommendation for those core vaccines has changed to every 3 years. All right, let's talk about Parvo. If you've never heard of Parvo, do you have a dog? So canine Parvovirus is a very serious disease. And again, it looks a little different from distemper, but it is equally horrifying. Anyone who works in vet med can tell you that treating a Parvo patient is probably one of their very least favorite things to do. People who work in emergency clinics or specialty hospitals or 24/7 facilities that actually do see a good bit of Parvo will tell you that is miserable for everyone involved. Parvo is a virus that is extremely hardy. It's very tough. It's very contagious. Like, it's so contagious, and it also can last in an environment for a really long time. It's hard to kill it, and it's hard to get rid of it. I don't know if you've heard this, but if there has been like a Parvo outbreak on like a farm or someone's house, there is evidence that Parvo as a virus can hang around that area, even with, intense cleaning and disinfection and all that, for years at a time. So Parvo is not playing around. So Parvo is terrible, but also interesting. So as a virus, it attacks rapidly dividing cells. Where do those cells live? Well, intestinal cells are a really popular place with rapidly dividing cells, right? Because the tissue is changing and things. And so intestinal cells, bone marrow, and then lymphoid tissue. So, virus does a really good job at wreaking havoc when it can attack the GI system, and then also attack the immune system. And so not only does it make a patient really, really sick, but it also makes it really hard for a patient to fight off the infection. So it is spread primarily by fecal-oral transmission. So Parvo goes to other patients from poop, and poop is everywhere if a patient has Parvo. So it does a really good job of spreading itself, and it's really good at leaving itself. So like a dog has Parvo, they get fecal matter, even a microscopic amount, on some type of surface. That dog is way long gone from that surface. Parvo is still there. And so another dog can come along, lick that spot, as dogs do, and get really sick with Parvo if they're not protected with vaccinations. So it can really contaminate any kind of surface. So kennels, bowls, soil, soft surfaces, carpets, rugs, things like that. Dogs get really sick with Parvo. So they're lethargic, they're vomiting profusely. They absolutely do not want to eat. They can be drooling because they're nauseated. They get severe diarrhea. People that work in vet med or know dogs know Parvo has a smell. And really the smell of Parvo is because they're having bloody diarrhea, and the literal lining of their intestine is like sloughing away and coming out with their poop because it is just so inflamed and being attacked. They get dehydrated. Parvo also attacks their immune system, and so they can get low white blood cell counts, which means it's even harder for them to fight off the infection. And they can get cross-contamination of bacteria into the bloodstream because the lining of the intestine that's supposed to protect them from that is so damaged. So these dogs can get septic really, really fast. They can lose so much blood. They need a blood transfusion, and they are just so miserably sick. I would not wish Parvo sickness that dogs go through on my worst enemy. It is horrendous. It is notorious for infecting young dogs, puppies, and they're already susceptible because they're puppies and they're small and they die. Parvo has really high mortality rate. It is really dangerous, especially for puppies that have never been vaccinated. A dog that's never been vaccinated for Parvo gets Parvo. It is really hard to keep them alive. And it requires a lot of intensive treatment if they're really sick. We do treat some patients for Parvo outpatient if they have less severe infections or there's financial issues with keeping them hospitalized, which is very normal and common. And so we try our best. But again, not really a great treatment for it, except now we do have some new treatments that are very promising that actually do treat what's happening with the virus. But as far as like normal outpatient treatment, it's supportive care. We want to keep these patients hydrated, support them while their body tries to fight off the disease. And it's terrible. And it's a slow, miserable death. And the good news is we have a really good vaccine for Parvo that works really well. It works quickly. We do want to give our puppies the full series of Parvo vaccines with distemper. But it's very protective. Again, we recommend that every 3 years after their initial series, but the vaccine works really, really well. And we don't really see Parvo in vaccinated dogs. And before the Parvo vaccine existed, I can tell you that veterinarians who were working and seeing Parvo outbreaks would tell you we don't want a world where dogs are not vaccinated for Parvo. So very good vaccine, very, very important vaccine. There's a reason it's a core vaccine. And then the last part of that combo is Parainfluenza. And this is a respiratory virus, as it sounds. And Parainfluenza is another organism that's involved with canine infectious respiratory disease complex, which some of you know as kennel cough. If you didn't know this, we've talked about this some before, but kennel cough is just a name for like the clinical picture. So a coughing dog that has some type of pathogen that made them have this inflamed trachea and upper airway, and they're coughing. They have this dry coffee hack. And sometimes they have that terminal retch where it's like they're trying to cough something up and they never really get anything up other than phlegm. And parainfluenza is one of the things that can cause that kennel cough. So it is spread through the respiratory system. So again, respiratory droplets and contact between dogs. So boarding facilities, daycares, dog parks, grooming facilities, shelters, anywhere there's multiple dogs in one place is where they're going to pick up parainfluenza. Symptoms are what we think of when we talk about kennel cough. They can develop nasal discharge and a fever, and they can get secondary pneumonia, which is really what we want to avoid, right, when we're protecting these dogs against these respiratory diseases. So the vaccine is not going to keep a dog from having kennel cough necessarily, but it is going to provide some protection with specifically parainfluenza, and it's going to lessen the severity of disease if these dogs pick it up. So it's just as important as anything else because we don't want them to get really sick and we don't want them to get like secondary pneumonia. And so vaccinating for these diseases that cause kennel cough can really help with that. So those are the 4 parts of what we call a distemper combo or a distemper parvo vaccine. And this is why it's considered core. These diseases are not secluded to one area of the United States. They can be anywhere and everywhere. And so all dogs, at least in the US, should be vaccinated for distemper, adeno, parvo, and parainfluenza as puppies until they're 16, 17 weeks old. Every 3 to 4 weeks is generally what I recommend. Then they get a booster a year later. And then every 3 years after that is what's recommended by AHA. Okay. Moving along, because we got a lot to go. Leptospirosis. If you've never heard me talk about lepto, it's a soapbox of mine. So leptospirosis, we call it lepto for short. A lot of people know about lepto because people talk about it. Lepto is a bacteria, Leptospira bacteria. And lepto has now been called a core vaccine for dogs. And the reason this is like a new thing that's a change is because for a long time, lepto was considered a lifestyle vaccine. So we primarily focused on dogs who were like hunting dogs or farm dogs, dogs that were outside around still bodies of water, just like out in the elements a lot, to be vaccinated for lepto. And the reason for that is how it's spread. But that has changed, and it's changed, one, because the actual pathogen, lepto, and the bacteria has spread. It's found all over the US now. And so it is everywhere. It used to be a bit regional, but now lepto can be found everywhere. And we now know that because of this spread, really any dog that exists in the US can be exposed to lepto. I can tell you from personal experience, I worked as a vet in downtown Nashville, and I diagnosed a few like small little apartment dogs with lepto. And so if they're susceptible to it, all dogs really are. So what is lepto? Lepto is a bacteria. It is also terrible but interesting. So lepto has a category of critters that help spread it. So it is carried by small mammals and rodents who harbor the bacteria in their urine. And so when they urinate in the ground and water, whatever, it gets into the environment. And so they're what we call reservoir hosts. So they hang on to the bacteria and then they spread it around. And then your dog can touch the ground, lick the ground, drink some water, lick a puddle, whatever, come into contact with their environment, wherever that is, and they can pick up the bacteria. So lepto is a nasty bug, and it attacks the kidneys primarily, but can also cause liver injury and disease. So these dogs often they're lethargic, they have a fever, they get sick, they're dehydrated, and they will have signs of kidney disease. So all of those things. They can also have signs of liver disease and jaundice. And some of these dogs get this terrible side effect of lepto infection where they get pulmonary hemorrhage and they get really, really sick, and they can't breathe very well because their lungs are bleeding. And that sounds terrible, doesn't it? And so that is why lepto is important. Another really big reason why vaccinating and talking about lepto is important is it's what we call zoonotic. So it can be passed on to people. So dogs can be infected with lepto and pass it on to people. And so we now consider it a core vaccine. There's also this antiquated thought that the lepto vaccine causes more reactions than other vaccines, but it simply does not. We know that now. The vaccine formulation changed a very, very long time ago, like 15, 20 years ago. And we now know it is not more reactive than any other vaccines. So it is okay to give lepto to your small dog. And the vaccine provides very good protection for 4 serovars of lepto. There are over 200. Sometimes this is something I hear people say oh, the vaccine's no good because it only covers 4 strains. Well, we know we can get cross protection between strains of a certain organism or pathogen with vaccines, and the serovars that are picked for the vaccine are purposefully chosen because they're common. And so lepto vaccines, we know, help significantly with the severity of clinical disease with dogs who get exposed to lepto. So can they still get infected with lepto? They can, but we know that if they've been vaccinated, if they get infected, how sick they are is significantly lower. And so it's really important that you consider vaccinating your dog for lepto if they live in the US, period. It's considered a core vaccine. This is a really, really important one. And because it is a bacteria and the immunity is much shorter lived because of that, we do recommend this vaccine every year. And there is a very, very good reason we do that compared to the Distemper Parvo combo that we recommend every 3 years once they're an adult. Okay, y'all know I could talk about lepto all day, but I won't. Next is Bordetella. Bordetella. It's a vaccine that's hard for people to say, but it's very, very important. People think Bordetella is the kennel cough vaccine. We call it that. But Bordetella is just one pathogen that can cause kennel cough like we've talked about. And it can be quite a dangerous one, which is why we want to vaccinate against it. So this is another bacterium, another reason why we vaccinate for Bordetella every year. And it is one of the major pathogens that we can find with cases of kennel cough. And just like the other respiratory diseases, it's spread through respiratory secretions, dog-to-dog contact in crowded areas like boarding and daycare. And they get that honk, honk, honk goose cough. So that's what Bordetella looks like. This is why we vaccinate for it. The vaccine is not necessarily, again, going to prevent disease entirely, but it's going to significantly lower the severity. It's going to hopefully keep your dog out of the hospital, keep your dog from having pneumonia that could be fatal, and they may still have a little honk honk cough for a few days, but they're not going to get severely ill, most likely. And so Bordetella vaccination is important. This is considered a lifestyle vaccine. So I would say most of my patients, we're going to talk about vaccinating for Bordetella because one, they come to the vet clinic where there are other dogs that could be carrying it. And two, a lot of them live in neighborhoods where there are a lot of other dogs or apartment complexes. And so generally, I think most dogs who go anywhere ever, it's probably a good idea to vaccinate them for Bordetella, but it is not considered a core vaccine. It is a lifestyle vaccine. We also have intranasal and intraoral Bordetella vaccines, which is kind of cool. So it can work by just spraying it in the nose or the mouth. We also have injectable as well. So next, along the same lines, canine influenza. We do have a flu vaccine for dogs, and canine influenza is an influenza A virus. It can look like kennel cough when dogs get infected with influenza. There are two major strains that we have a vaccine for. So H3N8 and H3N2 are the two. Interesting fun fact, N8 emerged in dogs after it originated in horses, and the N2 one was in birds and then went to dogs. So horses and birds. So same kind of spread. It's a respiratory disease. It's spread by respiratory droplet secretions. It can be carried between dogs by people or materials, toys, floors, bowls, things like that. Again, dogs who are socializing a lot or in like high dog concentration environments are who will pick it up. It does look a lot like kennel cough at first. So we can have coughing, but then a lot of times these dogs also have more sort of other respiratory symptoms. So sneezing, more likely to have like nasal discharge. They can get a fever and lethargic. In my experience, when I see dogs with what sounds like some type of like kennel cough or something, I get more worried about influenza if they're like, they don't want to eat and they just don't really feel good and they get a fever early on. And then there's a subset of these dogs that will get pneumonia, and that is a pretty wicked pneumonia. I've seen it several times in my career, and they get really sick. So the influenza vaccine, canine influenza, is another vaccine where our primary goal is to reduce the severity of disease and transmission as well, rather than like guaranteeing that they can't get flu. But again, it's going to help keep dogs that might come into contact with it out of hospitals, keep them from getting pneumonia, because the pneumonia is what's really dangerous for them. And then also reduce their shedding of the virus so we don't pass it on as much. We see a lot of flu outbreaks every year or two. We'll see like a flu outbreak in town, like all the boarding facilities have flu. And it's terrible. So it's a good idea to vaccinate dogs that, again, are in those kind of like communal environments. And then the last dog vaccine I was going to talk about is Lyme. So Lyme is a vaccine that is growing in popularity because Lyme is a disease that's also growing in its presence. So Borrelia is what Lyme disease is, the pathogen, and it is spread through a tick bite. So it's a tick-borne pathogen that we do have a vaccine for, and it's Ixodes ticks that spread Lyme, Borrelia, and these are called black-legged ticks or deer ticks. So dogs don't pass Lyme disease on to other dogs. The ticks carry it between them, and when dogs develop illness that have been exposed to Borrelia, they, if they get sick, which they don't all get sick, they often have fever, lethargy, they can get big lymph nodes, they can have joint pain and lameness in their legs. And then there's a condition they can develop called Lyme nephritis, where their kidneys get really angry, and they can go into kidney failure. It can be devastating. It's like an immune-mediated attack on the kidneys, and is associated with that infection. So yeah, Lyme is yucky and ugly too. It's growing in where it is. It used to be sort of like northeastern US sort of thing, and we're starting to see it here and in other parts of the country. So more and more vets are vaccinating for Lyme because they're seeing more of it. And the vaccine, it's again something where it's not going to necessarily prevent any development of disease, but hopefully lower the severity. Tick protection and prevention is really, really important, probably more important even than the vaccine when it comes to protection from Lyme disease. And so thank goodness we have really efficacious tick preventions on the market that are safe for most patients. All right, we did it. That was the dogs. Let's talk about the cats. So cats have less, thankfully, that we have to protect against, and some of it is a little bit serious or similar, not serious. So if you have cats, then the like annual or every 3-year kind of core combo vaccine that's similar to like distemper, parvo, and dogs is what we call FVRCP, or we also call it CVR, depending on where we're getting the vaccine. So let's talk about what those are. So the first part of the FVRCP is feline FVR. So feline viral rhinotracheitis. What the heck is that? So this portion of the vaccine is a viral upper respiratory problem that is caused by feline herpesvirus type 1. So if you don't know about herpes virus in cats, one of my professors in vet school, Dr. Kennedy, used to say all God's children got herpes. So we all can get a version of herpes virus. And in cats, it is a respiratory problem mostly. So herpes virus is spread through nasal, ocular secretions, and saliva. So cats in close contact, often litter mates or like cats in shelters together, spread the herpes around. It can cause sneezing, nasal discharge. They can have eye discharge and inflammation of the conjunctiva around the eyes. They can develop corneal ulcers because of that. And then they can get pretty sick and have fevers and decreased appetite. Fun fact, a lot of cats, if they can't smell, they don't want to eat. Smelling is very important for cats. And the other terrible but cool thing about herpes virus is the virus infects a cat and then it can become latent in their immune system. So it basically like hides within their immune nervous system, and then it can reactivate later. And if a cat is stressed or immunocompromised for another reason, that is a great time for herpes virus to rear its ugly head and cause another respiratory flare up, and then they can get secondary bacterial infections because of that. So the vaccine, again, for herpes virus does not necessarily prevent infection or even latency. But what it is going to do is reduce the severity of the clinical disease, like these other vaccines we've talked about, which is really important. Honestly, a lot of cats get exposed to herpes virus. Most cats are walking around with some familiarity with herpes virus. But if they're vaccinated, then they're less likely to have those flare-ups and they're less likely to get real sick from them. So that's why we vaccinate for it. That's why it's really important. But this is part of this combo that after they're kittens and get their first booster, again, we recommend that now every 3 years rather than every single year. So the next part of that combo vaccine is Calicivirus, which I like to say because I like Game of Thrones. And Calicivirus is similar to herpes virus, but same but different. So Calici, very contagious respiratory virus. There are actually, unlike herpes, a lot of different kind of strains of Calicivirus that are around. Spread the same way, saliva, respiratory secretions, discharge. It can be spread through contaminated objects. Does a lot of the same thing. Sneezing, nasal discharge, they can have a fever. I do see Calici cats have like oral ulcers, and they can also have eye issues. There are some strains of Calici that can cause like joint pain actually, and more severe systemic disease. So Calici is similar. The vaccine situation is similar. There are different strains, and so the vaccine isn't necessarily going to cover all of them, but we know that we have some cross protection, and we know that vaccinated cats have significant reduction in their clinical signs. after they've been vaccinated. So again, really, really important. We want to keep them from being very, very sick if they get infected with calicivirus. So then we have Feline Panleukopenia. So this is the cat's version of Parvo. It is a Parvovirus. And again, if you work in cat medicine or like shelter situations, you know that panleukopenia is a horrible disease. So feline panleukopenia is extremely contagious, like Parvo. It's like the feline counterpart. So fecal oral transmission, again, can be spread through contaminated viruses or environments. It's extremely hardy. It's extremely contagious. It can hang out anywhere outside of the body. And it attacks rapidly dividing cells like Parvo, intestinal cells, bone marrow, lymphoid tissue. So it attacks the GI system and also the immune system. These cats look similar. They have fevers, they're vomiting, diarrhea. They get very dehydrated. They have low white blood cell counts. This can wipe out kittens so fast. So you'll occasionally will see feline panleukopenia go through like a shelter situation where there are a bunch of kittens, and you can have like dozens of kittens die from this very, very quickly. And it is horrible. So it is something that's so important that we vaccinate against. If you've ever heard of cerebellar hypoplasia, this is a neurologic condition in cats. So some kittens are born with underdeveloped cerebellums, and that is usually because their mom was infected with panleukopenia when they were pregnant with kittens. So another interesting but terrible fact. The panleukopenia virus works really, really well, like the Parvovirus. These vaccines provide really, really good long-lasting immunity, which again is why every 3 years for that vaccine is what we have transitioned to in a lot of places and what the recommendation is. So in cats, that's the FVRCP combo vaccine, everything that covers. Our kind of like lifestyle vaccine in cats is feline leukemia. If you've never heard of feline leukemia virus, it is a retrovirus. So retroviruses are really gnarly pathogens and can cause persistent infection. So cats with feline leukemia have basically impaired immune systems forever. This is spread by prolonged, close contact with other cats. So cats who maybe fight and bite each other and share saliva or live together, share bowls, things like that are who infect each other. So if you have outdoor cats, feline leukemia is one we want to vaccinate against. It's really, really important. This is why we test cats for feline leukemia. This is why we want to know if they have it before they go out into the environment, because we do not want them spreading it to each other. It does lead to immunosuppression. They can get recurrent infections. They can have bone marrow disease, anemia, and they're more likely to develop lymphoma and leukemia if they have underlying feline leukemia virus. So sometimes people get confused and they think like that it is cancer. It's not, but it does make them more prone to developing cancers. And some cats do better with this viral infection than others. Some get really sick and they don't really ever recover, but a lot of them have feline leukemia and they kind of trot along, but it can lead to a lot of other secondary problems. So this is why we vaccinate for it. It's why it's really important that we test for it. We want to know if they have it. We want to vaccinate them for it and protect them if they don't have it. And we don't want to send cats into the world outside if we don't know their status and if they're not vaccinated. So, it's the vaccine provides protection and coverage, and it's important, and it's really just the responsible thing to do if you're going to have outdoor cats, which is a whole conversation in itself. Do we have outdoor cats, domesticated cats? But it is what it is. But it is considered a lifestyle vaccine. So we do usually reserve it for cats that do go outside, because that's where they're going to pick it up, and then also where they're going to spread it. Indoor only cats, sometimes we still talk about vaccinating, because if they go out some or their life may change, it's good for them to have protection, but we can always vaccinate them for that if we know, okay, now they're going to go outside some. Okay, those were the big ones. We just got through 16 pages of my notes. I wanted to make sure we covered everything. And I don't know if you're still listening. I hope this was helpful. I think it's important for you to understand what we're talking about when we talk about vaccines. And so hopefully this gives you just kind of a better handle on what all of that is and what we mean when we say you need the distemper combo vaccine today. And I would love to know what questions you have about it. We want to do a Q&A episode soon. And we've got some interviews coming up. So let me know what questions you have. I hope this was helpful. And if you're watching, you can always listen to us in the car or on the go. And if you're listening and would rather watch on YouTube, we are there. Make sure you're following Dr. Molly Says Pod on Instagram and TikTok. And me, Dr. Molly Says, and now also the local vets. I'll see you next week on the Dr. Molly Says podcast.